JES Foundation Repair, the Virginia Department of Emergency Management, and the Virginia Department of Health are proud to sponsor this special news presentation.
Welcome back to Virginia Responds, your questions answered. I'm Juan Conde.
And I'm Constance Jones. We're now joined by Virginia Senator Mark Warner via Zoom. Thank you, Senator, for joining us this evening. Our first question is about the news that broke today. Chuck Schumer announcing a deal to help small businesses. What can you tell us about that?
Well, Constance, Juan, first of all, thank you for having me on. It's been a wild few weeks, and I think the news that came out of D.C. today was good news. The Senate passed in a unanimous way $484 billion that does two or three things. One, it replenishes the program to support small businesses. This program provides 8 weeks of payroll and some overhead. And our concern early on, the first $350 billion of this were used up by businesses. And I was concerned that too often the businesses that might have been getting these grants had not shown economic loss. I think we've seen some of the press reports that there were some brand name public companies. That was not where this program was supposed to help. It was supposed to help, the beauty salon, the barber shop, and we wanted to make sure that businesses that just didn't have connections with banks were getting these funds. So we've replenished the program, and that's good news. We've also made sure that small businesses, micro businesses, minority businesses will get some of these fundings with a certain set aside. So that's part number one. Part number two of the program that will be, I think, passed by the Senate today, hopefully passed by the House on Thursday, will put $75 billion of additional funding to our healthcare systems. A lot of our hospitals who, are doing yeoman's work, but many of them have actually seen a great decline in revenues because they can't do elective surgery. So we wanted to make sure hospitals, that small doctor's office that's not seeing patients right now, has some support as well. Matter of fact, we had some pretty challenging news I had with a group of docs today that were saying that, they've seen a 30% decline in infant vaccination rates, a 70% decline in young adults vaccination rates. So I would urge all of our viewers, those doctors' offices are still open. If you haven't gotten your child a vaccination, please do not miss that, because that could be a longer-term healthcare problem. And then finally, what was in the plan today was $25 billion to help support a testing program. If we're going to reopen our economy, which I want us to do, we've got to increase our testing capacity. And that means, we need a central location, a central site where you can check how many tests in Richmond, Roanoke, Hampton Roads, what are the tests that are about to come online. And unfortunately, the federal government so far has not provided that kind of central testing information. And if we're going to get the economy reopened, and the president's asked me to serve on a task force on this, we've got to make sure we've got more testing capacity. So this bill also would include money for that. So I think steps in the right direction, and my hope is our House colleagues will pass it on Thursday.
All right, Senator Warner, now the president appointed you to the committee to reopen America First. What were your thoughts when you were named to the committee, and what's some of the work that you guys have already been doing?
Well, listen, I have many things that I disagree with President Trump on. Our politics are very different. But when the president asked me to serve on this kind of commission, I'm, country first in a crisis like this. And my only ask back of the president was, let's make sure that decisions you make on reopening the economy are going to be based on data, are going to be bipartisan, and they're going to have to be relying on healthcare recommendations. And we've had one call, and there were lots of folks on the call, and many members of the Senate, and I didn't get a chance to pose my question, which was going to be about testing, which I think we need to really have a federal response on. And my hope is we'll have another call, we'll have other meetings. What I don't want to be part of is simply a political effort if the president isn't going to really listen to advice from folks that he might not always agree with. And I want the economy to be reopened, but the thing that would be the worst, and I know you had the governor on earlier tonight, and I have great faith in the governor. He's a doctor. He's the only governor in the country that's a doctor. We need to make sure that while we want to reopen, we do this in a safe way. The president himself has said he wants, 2 weeks of declining infection numbers before a state goes to phase one. And unfortunately, in Virginia, we've not seen that decline yet. On a national level, in New York and elsewhere, they're seeing declines. In Virginia, we're not. So I want to make sure that we see declines in Virginia. And I really, really think we need to do more on testing. If a business is going to reopen, I want to make sure they can test somebody that may show signs of the virus, that we feel a level of security. Because the worst thing for our economy and the worst thing for Virginia would be if people were rushed back to work and they didn't feel safe and we saw another spike in the virus. I've been talking to lots of healthcare experts, and that is a real concern. I think we can deal with it, but it is a real concern.
All right, Senator Warner, you're a big sports fan, and again, within the context of what you just said about using data to make smart decisions about reopening our economy, do you have an idea in your mind, or is there an idea in the mind of experts when it might be feasible to bring back larger sporting events, your baseball games, your football games, where many people might be sitting together at one time?
Right. Well, Juan, you're right. I love sports. I'd love to get back into seeing games, and how many reruns can we watch on ESPN before we go? And whether it's in baseball, the fact that the Nationals were going to come back out as world champions and their season seems to be stymied. Or I have to say, we've got a lot of great football across Virginia. As the governor that got the Hokies, the Virginia Tech Hokies, into the ACC, I've got a soft spot in my heart for them, even though I didn't go to Tech. So I would love to have that kind of, I'd love to have that kind of sports experience again. But, we got to be safe. And I think it's too early to tell. I would actually hope that our viewers, sports fans, would listen to the healthcare experts and not the politicians on this. Nothing would be worse than to, having a sporting event, because it appears that the site that ended up spawning not only the virus in many ways in Italy, but those who followed, Spain had a huge, one of the worst cases of all in Europe. And a lot of that may have come from a soccer match played between Valencia, one of the Spanish teams, and one of the Italian teams. And that ended up creating huge chaos in Spain. We don't want that to happen. So, when it comes, it will come, but let's let the healthcare experts determine that.
A data-driven decision. Senator Mark Warner, thank you very much for joining us tonight here on 8 News.
Well, let me just, thank you guys. Thank you. I know we've got lots of stations around the state. My final comments would simply be, we're going to get through this. I have great faith in Virginia. I have great faith in our country. The only thing I would ask is that we all show each other a little bit of grace. These are extraordinarily hard times, economic stress about the illness. If we can all show each other a little more kindness, a little more grace during this period, I think we'll all be better off.
All right.
Thank you so much.
Thank you very much, Senator Mark Warner. A bit of grace for all of us. Do some good.
Yeah.
Senator Tim Kaine has been active in Washington securing money for small businesses.
That's right. I asked him about the deal Senator Schumer announced earlier today.
I just finished a call with all the Democratic senators, and here's the basics of it. The Paycheck Protection Program, which is key for small businesses, forgivable loans, $350 billion, but all of those funds were used in the first few weeks. Of that amount, 40,000 Virginia businesses qualified for $9 billion in loans, but we needed more. So here's what we'll do. For small businesses, we'll increase that Paycheck Protection Program by another $250 billion. We will have a $60 billion loan fund that will be specifically administered through small banks, minority-owned banks, credit unions, and community banks, and an additional $60 billion through an SBA program called the Emergency Loan Program, which is $10 billion for grants and $50 million for loans. So bottom line, we're going to increase small business lending by another $370 billion. On top of that, we will also do $75 billion more for hospitals and healthcare institutions, and $25 billion to have a robust federally directed testing program for Americans, so we know when we're safe to reopen the economy and get back in the community.
All right, Senator, how can the federal government help us with testing at this point? We know the CDC is sending teams to every state in the country to assess testing concerns, but here in Virginia, there are some major issues with getting testing supplies and setting up testing sites.
No, there have been major issues since the very beginning, and this is, unfortunately, the United States lost 6 to 8 weeks because the president said that this was not going to be a problem, and then the CDC stumbled out of the gate in terms of providing testing. So compared to other nations, we are far behind. But in both of the last 2 bills, the bill that we passed at the end of March and then the bill we're likely to pass in the Senate today, there's robust additional funding for all the components of the testing. The test kits themselves, the nasal swabs, the chemical reagents that you need to be able to run the tests and analyze the results. And we are setting up basically a directive that the federal government establish a testing protocol and then give the American public measurable results every week about where we need to be and where we actually are. Just saying, you know, everyone can get a test when it's not true, or we're doing more this week than we were doing last week isn't going to be enough. But with the passage of this bill this afternoon, work that we did in the last bill and this bill together, we should have the resources to start to make sure that Virginians and others are served by a testing protocol that the United States should have.
Well, Senator, what are your thoughts about the state of Maryland buying tests from South Korea?
Well, look, governors have had to go out and buy equipment. Some have bought tests, some have bought personal protective equipment. In Virginia, we've had to do that, and that's been because of the lack of a coordinated plan at the federal level. You know, it would have been better to have this coordinated at the federal level through the Trump administration's agencies, but when state governments got tired of waiting, they've gone out and they've made purchases, and it may be ventilators, it may be personal protective equipment, it may be test kits, but that was governors getting frustrated with the absence of a coordinated response from the administration.
Well, Senator, the president said last night that he was stopping all immigration because of COVID-19. What's your response to this? It
is an effort to deflect blame from himself. He's trying to suggest that immigration is the problem. It's not. The problem is, first, this is a global pandemic. It's hard for any nation to deal with it. But what we've seen from the administration was, first, years of systematically dismantling the public health infrastructure, including agencies and resources within the White House, the State Department, the CDC, to help us early detect pandemics. A president who for about 6 to 8 weeks claimed this was not going to be a problem for us when it was, and then a significant problem that the administration was not able to get testing online, as was the case in other nations. The president attempting to suggest that immigration is the cause is merely an effort to deflect the blame that he has to hold on his shoulders as somebody who's responsible.
Senator Kaine, what is your closing message to Virginians?
The closing message to Virginia is this. Look, folks are very, very frightened, from the grocery cashiers that I work with to the small business owners I talk to every day. And look, we lost 6 to 8 weeks, but when Congress started to act in early March, we have passed 3, and then this week it will now be 4 pieces of significant legislation: aid to individuals, aid to small businesses, aid to large businesses, aid to state and local governments, aid to hospitals and the healthcare industry. And we're not done. So I would encourage people to follow the best public health advice that we're hearing at the federal level and from the governor. Do all you can to stay safe, and we're going to do all we can in Congress to try to provide the financial resources to have both testing and economic aid that people need.
All right, Senator Tim Kaine, thank you for your time. All right, the senator also answered some questions for Virginia residents who speak Spanish. We'll be posting those answers online.
And when we come back, we'll speak to Dr. Lori Forlano with the Virginia Department of Health. Stay with us.